Oh yeah, oxygen as well, yeah. Anything else? Right. Okay then. So this is going to be flawless, obviously. Right then. So, approaching the patient, we're inside, it's warm, it's dry, it's well lit. Patient appears collapsed on the floor, unresponsive. Doesn't appear to be any dangers to myself, patient or my crewmate. Patient assessment triangle, so the patient is pale, unresponsive, doesn't appear to be any effort of breathing. Hello, can you hear me? Open your eyes. Okay, looking for catastrophic hemorrhage. There's no mechanism of injury to suggest, and I can't see any blood. To check for response again. Hello, can you hear me? Open your eyes. No response. Can you put the defib on for me, please? Okay, back one. Checking the airway. Cross-finger technique, checking for foreign bodies, vomit, considering suction, McGill's forceps. No mechanism of injury, so head tilt, chin lift.
Open airway. Check.
I'm going to look, listen and feel for 10 seconds, looking for rise and fall of the chest, listening for breath and feeling for a carotid pulse. No breathing, no pulse, confirm cardiac arrest, request backup. Start CPR, come on. Okay, and he's kindly put that in manual for me. Okay, off the chest for me. In VF, so charge him.
Touch patient. Charging.
Okay, stand back, safety check, shock him.
Shock delivered.
Back on the chest for me. Can you count me in from 25?
Check patient.
Keep going for me. In all seriousness, that's what you do. So if you're not ready, make sure you're ready and not them, yeah? Okay, stop. Checking for adequate rise and fall. Carry on for me. So when you get to 25, count me into 30 if you can, please. Off your chest. Carry on. So looking to secure the airway with an OP, measuring from the incisors to corner of the mandible, invert it past the tongue and into the oropharynx. So we're coming up to 2 minutes now, so I'm just going to sit tight for a minute. Keep going. I'm not going to do anything else in this window. So this is the hard bit, sitting here doing nothing. Okay, that's 2 minutes, stop there. Checking for rhythm. VF, still in VF, so charging.
Touch patient. Charging.
Around safety check, stand back.
Shock
Back on the
delivered.
chest for me. Can you scoot down to here and do ventilations and compressions for me? Come on, thank you. Back on the chest. So now I need to look at getting some IV access. Getting rise and fall there.
Yep.
Happy with the airway?
Yep.
Come on.
Check patient.
Of course, I would have used a tourniquet there to get IV access. Meds check. Yeah. So 10 mils. Flush. So 3.5 minutes. So I'm just conscious of time. Right.
Check patient.
So I'm assessing the rhythm again. We're almost at 4 minutes. Still in VF. Off the chest. Charging.
Charging.
Around safety check. Stand back.
Shock delivered.
Okay, back on the chest for me. So that's 3 shocks. So going with my first adrenaline and amiodarone. So adrenaline, let's check.
Yeah, one sorry, one step fast.
Okay, adrenaline, flush, amiodarone. Yep. And flush again. Okay, so that's 3 shocks. Coming up to 5 minutes, so I've got a little time to spare. So in that time, think about 4H's, 4T's. I'm going to set some fluid up. Let's just have a bit of time. So I'm just taking the time that I would do to set this up now, with it already being set up, just to keep things realistic. Okay, so got some fluids going. Bolus of 250 mils, maximum of 2 litres. Okay, so again, I find myself with little to do, so I'm just planning ahead. I'm always thinking about 4H's, 4T's. Okay, coming up to 6 minutes. So after you finish that one, do the breaths and we'll check the rhythm, yeah? Okay, so that's still VF. Charging.
Charging.
Around safety check. Stand back.
Shock delivered.
Back in the chest for me. Can you scoot round to the side for me? Okay, so now into another window, so I'm going to look to escalate the airway.
Check patient.
So considering suction, OP out, IGL in, and tidal, catheter mount. Looking for rise and fall. Happy, carry on. Okay, stop. Clear air entry, carry on. Happy there? Let me know, count me in again. Oops, go on, I'll do it, just count me in from 25. So the clock's at 7:45, so I'm just going to finish this off and then we're going to reassess. Checking for an end tidal between 4 and 5.7, looking for rise and fall. Stop there. VF. Charging again.
Charging.
Okay, stand back.
Shock delivered.
Okay, back on the chest for me. Okay.
Check patient.
Come on. You happy doing both? Yeah? Okay, BM. 5.6. That's good. So 4H's, 4T's. Hypoxia, I've got airway, capnography, SpO2 and adequate ventilation. Hypothermia, we're inside and it's warm. I could do a temperature though, there's nothing wrong with that. Do a temp. I was surprised, 36.9. Hyperkalemia, we've done a BM, that's good. So considering all metabolic disturbances. Hypoxia, hypovolemia, hypothermia, hyperkalemia. Hypovolemia, we've got fluids running. Toxins, check pupils, there's no paraphernalia, pupils are fixed and dilated. We've got fluid running, tension pneumothorax, clear bilateral air entry, good end tidal, good SATs. Tamponade, we're not considering, it's not traumatic, but we've got effective CPR, and the same for thrombus, thromboemboli, that's what we are considering, but we've got good CPR going on, patients in persistent VF. Okay, so, so we're at 10 minutes, so stop there, let's have a rhythm check. Asystole,
Check patient.
no pulse, carry on. Okay, now what? Drugs. So it's CPR and adrenaline, isn't it? Yeah? CPR and adrenaline every 5 minutes, check the rhythm every 2. Simple. Happy? Stop there, mate. Thanks for that.